So we did the coding quietly. What's up, everybody? So that thumbnail is very soothing. It's quietly. You're home, you're working quietly. You're doing your coding. You got your computers in front of you. You've got your reports. You are coding quietly. Maybe it's dark. Maybe you have your candle, or you just have your books and you just have the light on you and you are just working. You are just coding. You're not in the office. Nobody's bothering you. You have no coworkers that are in your vicinity. You are just coding. Your candle is lit and you're just coding. That's what this is about. Learning how to code. This is a beginner course of learning how to code. This course has medical terminology, medical billing, and coding. You have an advanced coding class at the end of the intake of your preliminary coding, okay? And that's because it's going to give you more coding. You will make yourself into an expert. You don't need to spend $27,000 for a college tuition to teach yourself something. No. Why, Miss Lambert? Because when you go to school, they're literally holding your hand to make sure you grasp what they are teaching you. In an online institution, you have to be dedicated and follow directions and have that mindset when nobody has to hold your hand. TT, where's your work? Mariah, did you do your homework? Kiki, pay attention. That's not how it's done online. Online, you're independent. Online, you are self-centered. Online, you make your own quiet environment. The catch is for you to pay attention. The catch, do you have the desire to learn on your own? If you do, then you will. If you have to be in a classroom physical, nothing is wrong with that. But the quietness of your environment where you are learning helps you to absorb, my opinion, absorb the work better. When you are in an online school, you can archive as much as you want. You can play back this very recording as much as you want. You didn't catch something? Play it back as much as you want. When you are in a physical class, yes, Mr. Jones, can you run that by me again? Miss Sampson, can you run that by me again? And then you have all these people around you, and then you go, should I ask again? I didn't get that. Should I ask again? When you're online, again, you're in your own environment. You have your own candlelight. You're in your own learning system. You, yes, have to focus and retain. When you're in a classroom, you may not want to say, Mr. Johnson, what was that question? You might be like, everybody's looking at you. You know what I'm saying? I'm just giving you the difference between the coding environment and the online learning environment. You can archive, you can play back, you can tap into what the instructor is saying without being shameful of asking, what did you say? Can you do that for me again on the board? That's why I love the online institution, because yes, it is more work because we are not holding your hand. I'm not going, TT, give me your work. Shamanda, where's your work? When I was inside the school, I love teaching in the school physically, do not get me wrong. But I used to have every instructor has one apple that you just want to go, and she would be destructive and destructive and destructive. And she didn't want to do nothing. She wanted that attention. She wanted to be the attention of the whole class. And you know what Miss Lambert does? Get out. That's the first thing I said. Oh, she didn't. All right, get out. So, she gets out, she goes up to my, my head region, and, she tells her to get out. And I told him why. She's the one to do it. Why you here? You distracting the other students with this, with the silly stuff. You don't want to be here. So if she was home and she got tired of looking at the class, she would just not do it. I wouldn't have had to put her on Front Street. Of course, eventually it was, I apologize, Miss Lambert. I'm not going to do it again. I'm here to learn. And that girl was my best student. I wish I knew where she was. This is what I'm saying to you. Online school may be for you. Traditional school may be for you. You see what I'm saying? In coding environment, we like for you to work as a team where we are all in the same area so that you guys can teach each other. But when you are online, we are not all in the same vicinity. You have your books. I have my books. She has her books in Canada. She has her books in Washington. Everybody is somewhere else. And this is how we are going to change YTU World Education. YTU is YouTube University. And the reason why we chose the YTU, which everybody says that now, but if you guys look 6 years ago, when I first created this YouTube, that was my goal. YTU, to teach you this full program. And I'm trying to get you to see that when you learn in coding, it's a mindset. When you are working, it's you in your home and you're working in your office. You create your office where and however you want to. You create your office. When the provider gives you those notes, you are deciphering those notes with tools that you are given from the hospital or the physician office. Okay? So, don't get scared of the coding. Coding, again, is to take something and to turn it into something else that is able to decipher and understand. So we take reports, we turn them into numerical form so that they can be billed and the providers can be paid. So when you are coding, you are taking something and turning it into something else for proper use. That's what coding is mainly about, whether it's physician coding, hospital coding, digital coding, gaming coding, whatever it is, you're turning one thing into something else. In our world, in our coding world, it's all about getting the money. This is an accounting field that you can teach yourself. You're being put in the right direction. You are purchasing courses. You are following what I'm giving you, and you are passing your tests. A lot of you are passing your exams, which, is good. Even though you have answers in that book. Remember the book that you guys are learning from, because I can't grade 200-300 people tests. So that's why I made the medical terminology book for you guys. Okay, you get those tests, take the tests. The answers are in the back of that book. Grade the test. Then you know where you're at. If you're stuck, to send me a message through YouTube or any discussion board. You guys know what discussion board is, right? Discussion board is Facebook. Discussion board is email. Discussion board is YouTube. Discussion board is FaceTime. What do you call that thing? Facebook. Discussion board is any way that we chat. Any way that we talk. This is discussion board. So that's the same thing that they use in Phoenix, same thing that we use in CTU, same thing that they use in universities online. It's called discussion board. This on this side is called discussion board. We call it the comment section, but in my teacher world, we call it a discussion board. And discussion board is where you put questions that you may want to ask. Discussion board is where you put, I have a problem with this, or I have a problem with that, Miss Lambert. And then you and I will do one-on-one. I did say I was going to put some links over here on the side, and I'm going to put the website link over there, coding.com. Okay, and you guys can go over there and Absolutely check out that website. I'm going to put Elsevier. I'm going to put Evolve up there first. This is where you guys are going to get the books from. Remember, there are several links down below. I also put the links to the Sapphire Coding bookstore. That's where you're going to get your courses from. The first thing that you're going to start in my class with is an orientation. This is for YTU because I want you guys to start purchasing those courses. I slashed those courses in half, more than half for the YTU students, for all students. The more students we have, the more I can drop that price down. When you go on sapphirephysiciancoding.com, go to enter courses or see more courses. Then you will see the bookstore there. It's like it has my books there, it has the courses there and everything that you need. The first thing that you start with is orientation. So, and again, find you a spot, put your candle. Okay. I don't care if it's dull, and then you practice just like now. Most of you guys are at work, and you guys know I don't do videos during the day, but I'm off. So I decided to go ahead and start doing the video during the day. Take your time and do your research. YouTube has so much stuff on it. There's no reason for you to go to college for billing and coding. Okay. We're going to show you 3 things. Do not forget to look at those playlists. There are 3 playlists. There's a medical billing playlist, a coding playlist, and a medical terminology playlist. Okay. You must look at those playlists to get this course down. Make sure that you have your books so that you can write your notes. Y'all know this is my pet peeve. I have books everywhere. Make sure you have books so that you can write your notes in. The CPC guide, yes, I use the CPC guide in my class because that's the end goal for you guys to take that certification. Okay, that's the end goal. This class is your endocrine class. Okay, your endocrine class is part of your coding. Okay, it's part of your coding. Your medical terminology is your key point in the coding. We are almost finished with the medical terminology. Okay, I want you guys to make sure that you are in a place that is comfortable for you when you are working. And even some of us who are at home, Chrome tab, some of us are who are at home and just kind of relaxing, and you want to just kind of pick up something, to do. You want to kind of look at a new skill that you want to do. Maybe you just had the baby, maybe you're just getting home. Find something that you can do with ease, that you don't have to put too much effort in. This is not a mandatory hour class. Even if you were in the Sapphire portal class, it is not. I do not hold you guys to sit there for 3 hours. We do 1 hour, and then you do your theory and your practice at home. Okay, so this is the endocrine system that we are on now. We're going to go through this today because this is a part of your coding. In coding, this is what we go through. We go through each part of the body. And now we are up to endocrine. If you guys can see, I'm going to put this back up. You have a very minimal amount of sections left. Look at this. 1, 2, 3, 4. We're done. You have literally 4 classes in your medical terminology. So guess what's next? The coding class is next. That's next. We have 4 classes left. You guys have any questions on the MT classes? Please let me know, because you have to take a test. You have to take an exam. Okay, now I didn't give you a medical billing exam. Sapphire, you guys already have your exam, but YTU, I'm not even sure how I will be able to give you an exam, but that's the reason why I put those tests in the back of my book. Go to Amazon or go to my website and check that book, sapphirecoding.com. That book has tests and answers. Okay, medical terminology is like your key component of coding. there's no way that you would be able to code those cases without medical terminology. Um, there are several classes and courses on YouTube. I love the girls and how they are showing you the coding and some of the tricks to the coding. When you get your coding books, I have those links. I'm going to put those links back up here for those free coding books. A lot of people are asking me for them. And again, you guys can get these books until you get your own books. I'm going to drop them links up there. Let me get to them. I dropped them on the last chat, and I think that this benefits you to drop these links back up here. I'm just going to put ICD-10 CM so that you guys can know that. And this is a link for that. And this is because these books are kind of expensive, but using these links, which is going to get you into that book, that's the ICD-10, will give you that head start. It's going to give you that head start in case you don't have your books yet. I'm not up to that section yet, so this is fine. I'm just going to put this whole thing in here where I don't have to type anything. Okay, next one. And especially for those of you who have never done coding before. My mom's out there. You've ever wanted to sample coding? You've ever wanted to see what it is like? These links that I'm putting on the side will give you an idea of what the coding is about. The medical billing and coding Q&A book, you guys can go to my website and get that book, and it will download right away. Okay. So that's my first 17 minutes. I wanted to make sure that, this is a relaxed field. In order for you to pass that exam, you just have to take your time, set out a couple of hours so that you can study for that exam. And like I said, here, you guys know, we start from scratch. Check out those 3 playlists, okay? Today, we're going to talk about the endocrine system. We're going to talk about the endocrine system. And again, this class is usually about an hour long. We might go in a little more than an hour. So coding quietly is, even if you are here and you're in this classroom, make sure that it is set, for you. Make sure that you have room to do what you need to do. Okay, so now we are talking about the endocrine system. And if you guys have any questions about the coding on the endocrine system, what I want you to do is, if you have your CPT book already, you're going to go to that series. Go to that series while you have your medical terminology book open, okay? Because that's how you see more illustrations. I'm going to show you illustrations in the book and how we're going to do it, but I want you to make sure that you have your own illustrations, okay? So today we are on the endocrine system, and we are at chapter 18. We're on chapter 18, okay? So those of you who do have your books, this is what we're getting ready to go into, okay? We're going to do thyroid, adrenal glands, pancreas, pituitary gland, ovaries, testes. We're going to talk about vocabulary and terminology, okay? A couple of clinical procedures, and you guys will see also abbreviations, okay? So endocrine system, okay? So let's see what the endocrine system is about. And again, this is your 1-hour theory that you have. I am using remember I told y'all about this book, see if they got it at Barnes and Nobles. Everything is actually in here that's actually in my big book. Okay, so the endocrine system is another regulatory or control system. Okay, it's another system. In our world in CPT, it is another series. Okay, it's another series of coding. Here, it is another system of the body. It consists of the endocrine glands and the hormones they secrete directly into the blood. So if you have a question on the hormones and they flip it around and they say, well, what is the endocrine for? You're going to say hormones they secrete directly into the blood. So what if CPC has a multiple choice question on the endocrine system? Basically, remember what I said, the answer is in the question. The answer is in the question. Hormones are chemicals that have precise effects on specific target organs. So if AAPC says, what are hormones? Chemicals that have a precise effects on specific target organs. See, you see how they're making the test. The questions that are on the AAPC are in the answers. They're making the test from all of the material that they have put together, and here they want to see if you have read it, okay, or if you have studied the endocrine system. Hormones belong to different chemical classes. Okay, and all of these classes, we're going to look at steroids, amines, peptides. We're going to look at all of those locations of major endocrine system, pituitary gland, the thyroid gland, parathyroid gland, adrenal gland, pancreas, ovaries, testes. We went into a few of those things and a couple of the other chapters, but here we just kind of breeze through this program because in this course it's pretty quick. The endocrine system, we pretty much have things going on in the endocrine system every day. And some of the stuff in the endocrine system we can't really look at, but we can still go over it. And this was something that I saw in here, and sometimes I kind of pick up these things. Okay, so testes suspended in the scrotum between the upper thighs. They're just pretty much telling you where they are. I mean, we're all grown folks here. We don't need to be, shy about anything. Pituitary gland below the hypothalamus, connected by infundibulum, the anterior pituitaries in separate glandular tissues, and produces its own hormones. So that's pretty much the stuff that you're going to study. Let's go ahead and get to our book because they're just breaking it up, the ovaries, the pancreas, and we're giving you like definitions of that. But I still want you to get these down because especially the thyroid gland, they might ask you this on your AAPC. The adrenal cortex, that sounds like a question. Your pancreas, they tell you what's in your pancreas, your glucogen, and they tell you what it does, raises the blood glucose level, insulin. Your ovaries has the estrogen, the progesterone. We need to see all of those things in your study and in your writing. Why, Ms. Lambert? Because those things will be on your test. Okay, so let me see if they have a nice picture here. They do show you. What happened to that? Uh-oh. Okay, so it looks like, my internet seems to be doing good today. Okay, so again, we're talking about the endocrine system. And I just put this picture up there to kind of put us in the right place. Okay, so again, you guys that have your book, we are pretty much just talking about introduction of the endocrine gland. This is a class that was due probably last Saturday, and we're just kind of catching up with it. Okay, the endocrine system is an information signaling system like the nervous system. Okay, like the nervous system. You guys remember when we did the nervous system? The nervous system uses nerves to conduct information. The endocrine system uses blood vessels as information channels. Totally different, totally different. Glands located in many regions of the body release into the bloodstream specific chemical messages called hormones. The Greek word is hormone. Now, y'all know, forget it. My pronunciation on all these words is done, but I'm expecting y'all to get them right. But you can see the much difference between the nervous system and endocrine system. They both have similar introductions, but they are totally different. They're totally different. Your endocrine system consists of so many different types of receptors, you can't even keep up with them. But, being that providers do so many surgeries on these different types of descriptions and medical terminology, you still need to know them. You do need to know them, okay? So you guys know how I do it. Just kind of go down and make sure you guys get some of the medical terminology, and make sure you get them on your books and your index cards. So glands, I want you to get that down. That's going to probably be something on your test. It's a definition. So again, you're just making practice cards. Hormones, I want you to get that down. Put that on your card, okay? With the definition. So if you don't forget, you can go to thrift.com and get you a book that does not cost that much money. Hormones produce their effects by binding to receptors, which are protein recognition sites in the various target tissues. Okay, various target tissues. And again, this is just giving you an introduction to endocrine glands. In your CPT book, when we get up to the code, and you're going to start reading more in depth about the endocrine glands. But what I would do is have my medical terminology book, The Language of Medicine, with me, and the CPT book. Okay, endocrine glands. Okay, that's what I'm up to. But I also want you to get this down. Take receptors, take target tissues. Okay, take receptors and take target tissue. Endocrine glands, no matter which hormone they produce, secrete their own hormones directly into the bloodstream. Okay, exocrine glands. Okay, it sounds like endocrine, but it's exocrine. There's an O instead of a D. Send chemical substances, tears, sweat, milk, saliva, milk as in breast milk, via ducts to the outside of the body. Okay, and I have a whole list here. You guys probably have the same list in your book, the ductless internal secreting gland. I'm gonna show you right now. So you guys probably have this already, this portion right here. And that's just pretty much telling you about what type of endocrine glands that you have. Your thyroid glands, your parathyroid gland, the glands that we just went over, adrenal glands, ovaries. And you know what, on your test, they may say, well, how many do you have? Parathyroid glands, there are 4. Adrenal glands, there are 2. Pancreas, islet of ligaments. There's many strings. There's many. Ovaries in the female, pair 2, testes 2, your pineal gland 1. And again, you're still going to look up those words. You're still going to look up those words. The last gland on the list, the pineal gland, is included as an endocrine gland, although less is known about the endocrine function on that portion, located in the central portion of the brain. Okay, you guys see that in the illustrations. I think when we did the brain, you guys seen that in the nervous system. If not, backtrack on that video. Okay, go back to, you're still in medical terminology, but you still can backtrack to that section. Okay, the pineal gland has been linked to mental conditions. Okay, let me see if they have a picture for us. I'm surprised they have a test here before they have it here. It's probably right here. Okay, I'm gonna show you this one. It's probably right here. And this is like a test for you to do. This is a test for you to do. So your glands are all there, but sometimes they have little tests that are in your ebooks for you guys to do. We're talking about the pineal gland, so they wanted to show us something from there. Okay, melatonin may be linked to the body's biological clock and its thoughts to induce sleep. Okay, the pineal gland has been linked to a mental condition, sensational affective disorder. That's not going to be on your test. Okay, that's not going to be on your test. In which the person suffers from depression and winter months. You guys ever seen somebody like that? In winter months, they're kind of different from summer months. I think everybody has a mood change depending on what, you know, whether it's summer or because in the summertime it's like you want to have fun, and in wintertime it's like we got to stay in the house. That's like a mood change to me. Okay, so hormones are also secreted by endocrine, which we know. Tissue and other organs apart from the major endocrine glands. So, you know, like sweating and all that kind of stuff comes from endocrine. I always, like I said, I always had like a sweat issue. You know, my hands used to sweat all the time. They actually don't sweat as much, but they still sweat. Okay, so make sure you get that down. So even though it may or may not be on a test, sensational affective disorder, SAD, I still want you to get it down. Okay, so human chronic gonadotrophy. I want you to make sure you get that down. because that is a part of an issue that has to do with the placenta. Okay. It's not going to be, you see how difficult, some of them are just too difficult. They're not going to be on the test. The easy stuff is what's going to be on the test. They just want to make sure you know it. Oh, I can't show that video. Did I show y'all that? They could definitely going to cut that. I didn't put that on there. All right. So I can't show y'all that part. It's a little bit disgusting. All right. So, endocrine tissue. Okay, apart from major glands, body cells, gastrointestinal tract, kidney, placenta, skin, and that's part of your reading. Just make sure you read that and highlight that. These are the things that's important right here. These are what you might might see on your test. The thyroid gland is composed of right and left lobe on either side of the trachea. The thyroid gland is important. What you see on your CPC is common things that we see every day. Your CPC will have common things every day. Hi, Avicus, how are you? They will have common things, okay? And like sometimes you hear me have trouble pronouncing stuff like that. That's not going to be on your test, okay? Some of these things that are easy, that's what's going to be in your test. Easy to pronounce. Okay. So on your index cards, you're going to have thyroid glands, trachea, thyroid cartilage. I'll read a little bit of it, but I want you guys to read it. On page 701, the thyroid gland is composed of a right and left lobe on either side of the trachea, just below a large piece of cartilage called the thyroid cartilage. The thyroid cartilage covers the larynx and produces the prominence on the neck known in men as the Adam's apple. Okay, we talked about that in another section about the Adam's apple on the boys, the men, you know, when it falls off or whatever. We talked about that in the other section, but this is something that will be on your test. I would suspect that they would have something like that on your test. You see how easy it is to kind of decipher. So yes, you do read it 2-3 times and then you're done with it. Some people can read it and then when they see it again, it's customary to them. The isthmus, ISTHMUS of the thyroid gland is a narrow strip of glandular tissue that connects the two lobes on the ventral, anterior, and surface of trachea. So again, you know, you guys are going to read this section. I might can put that illustration out, so I'll show y'all that. The next function, two of the hormones secreted by the thyroid gland are thyroxine and teratrodinin. Okay, that is what you're going to study. That might be on the test. I'm going to show you this right now. All you need to do is, you can do this if you want to. This is not like mandatory, but we still want you to know where these things are. So you knowing where these things are will help you on your study timeline. Okay. So in my book, I have tests that are under thyroid, and you'll have the same thing whether you have a hard copy book or you'll have an ebook. Okay. So another hormone that's produced by the thyroid gland is calcitonin. What was that? One of my friends, she had something, she used to have a lot of thyroid problems that had to do with her weight kind of fluctuating. All right, so calcitonin, I want you guys to go ahead and get that down. Calcitonin decreases blood calcium. I can't get this right. The parathyroid gland are 4 small oval bodies located on the dorsal aspect of the thyroid. Okay. This is like a test that they have down here for you. Epiglottis, pharynx, esophagus, and trachea. Make sure you get those 4 things down. Let me see what the answers is down here. Thyroid gland, parathyroid gland. Okay, they're just giving you tests after, you know, what we've read. They're just kind of giving you tests on that. If you have that in your book, make sure you get that, okay? PTH, parathyroid hormone, okay? Increases blood calcium. I think my mouse is going haywire. And again, these are some of the things that you're going to go over. I'm just kind of picking out some words that I want you to know. The adjustment of the level of calcium in the blood is a good example of the way hormones in general control the homeostasis. Definitely get that word down. Definitely get that word down, okay? Homeostasis of the body. If blood calcium decreases, as in pregnancy or with vitamin D efficiency, so they're saying the blood calcium decreases. We know because it takes a lot of nutrients from you to give to the baby when you're pregnant, okay? So let me finish that sentence. If blood calcium decreases, parathyroid hormone secretion increases, causing calcium to leave bones and enter the bloodstream. In the way blood calcium levels are brought back to normal. So you see how I'm kind of reading this, how I'm kind of studying it to you is not word for word, but the basics of what you need to know. When you get ready to start studying, you're going to go word for word. You're going to use your highlighter and what you need to study. You're going to definitely highlight it so you can actually get back to it. Okay. So I'm looking in here just to see, what's in my little book besides the other book to see what we can talk about here. Because they have some pictures in there that I can't show you. They're like, they're not disgusting, but even though it's not for children, I can't show those pictures. So your pineal gland, we were talking about the pineal gland that's here. Your hypothalamus is also here. Thyroid gland, you have your heart, your parathyroid gland. Remember the PTH that I told you about, the parathyroid gland. Make sure you get that down. Your thymus gland, I showed you all a picture of that. You all know your kidneys are here. Your pancreas is above your kidney. Not above, it's just in that middle, but the way that it is laying. So if you do get something, let's say you do get a test as far as your pancreas and your kidney, just be careful with it. They're going to give you multiple choice in that. They might say, where is it? Where it is. So if they say, where's your adrenal gland? Your adrenal gland will be at the top of your kidney. But that pancreas is right here, and here's the kidney. So the kidney, your kidney, your pancreas, and then your adrenal gland. So you see how it goes: 1, 2, 3, 4. When you're taking your CPC, you have to have a visualize of where that kidney is, where that pancreas is. That's why I always tell you guys to pull up something on YouTube to show you what the endocrine system looks like. They have pictures on my language of medicine, but they have, like the man stuff there and the women stuff. I can't show that. So this is the best way I could think of to show you where those things are without actually showing you that picture. Okay. Your ovaries, you guys already know where those ovaries are. It's estrogen, progesterone, your ovaries, your testicles, testosterone inhibition. That's what we talked about a little bit earlier. But again, these illustrations of what they will be looking for on your test. They just want to know, have you read it? Do you know anything about it? Testosterone promotes the development of the secondary sex characteristics such as growth of the larynx, skeletal muscles, and reproductive system. This is the same thing that you're going to look at in that language of medicine book. And I'm just giving you that same roundabout of, what's in the endocrine system. What's in the endocrine system, okay? Don't forget that PTH, parathyroid gland. It might say, well, what is PTH? Yeah, I had somebody that I know, they have that thyroid issue, and it either puts weight on you or it takes weight off of you. Oh, here's a picture here. Oh, okay. All right, hold on, y'all. I found one. I know my mouse is going haywire, but here's a kidney, and here is the adrenal. Hold on. I had a good picture, y'all, just to give you insight. Yes, it is the adrenal. So the kidney is there. The pancreas is not there, but this is fine. Let me see if I can push it up. I remember I had a question, something like that, about the kidney and the ureter or something like that. Okay, hold on. Okay, so let's get this. Let's take a look at this. That's pretty much the same picture. I'm trying to figure out why my mouse is not doing what I want her to do. Okay, so that's just a picture of what I was just showing you as far as where, where the kidneys is and where the adrenal gland is. And these two on the bottom are the ureters. Okay, I'm trying to give you a good set. And this is like a test. So you guys can also do this inside of your book. Okay, I'm on page 704. This is figure 18 to 6. Okay, the adrenal glands are two small glands, one on top of each kidney. Each gland consists of two parts, an outer portion, the adrenal cortex. Get that down. So if they say which adrenal gland is the outer portion, what's the answer, y'all? Adrenal cortex. And an inner portion, the adrenal medulla. What's the inner portion, y'all? A, B, C, or D? Adrenal medulla. The adrenal cortex and the adrenal medulla are two glands in one, secreting different hormones. The adrenal cortex secretes steroids or corticosteroids. Okay, complex chemicals derived from cholesterol. They're telling you what corticosteroids are. Okay, so in this case, again, you're only going to have 4 medical terminology questions, between 4 and 6, but that's still not enough for you to, get confused with it. Your focus, because I think you will do fine with that, with what you have right there, right here. Your focus is the cases. That's the focus. Your focus is the cases. When we start the coding, which will probably be in less than 2 weeks, maybe a week and a half, because you only got 4 sections of this. That's when I want you to kind of pay attention to this, because some of the names that the provider or the surgeon is going to start talking about will consist of this language of medicine. Okay, it's going to consist of this language. This is what this is. This is the Greek language of medicine for medical terminology. So in retrospect to that, again, AAPC will have 4 questions. You guys, I have a chat. We went over that in one of the medical billing chats. If you want to know what's going to be on that test, then you're going to go on that site and keep scrolling till you find it. So you want to go, when you go to that site, go to tests. And you can see what AAPC may have on that test. Okay, so when I say 4 or 5 questions, those are the open and closed questions. But again, we want to make sure that you at least have an idea of the endocrine system. Okay, this is not giving you a full-blown what's on that test, but we know that they're going to take stuff from different sections. And that's why, having that quiet area, having that quiet study zone, and lighting that candle and just sitting there and even just going over your book and your materials will help you to retain some of that information. Okay, so that's the gist of that. We want to make sure that you are studying properly and making sure that you are able to retain what you're studying, because that's the hard part. You start reading, some people just start reading. You don't start reading just to get finished with it. Okay, I want you to read it to actually learn it. Okay, because some of this stuff is really hard to learn. The more you practice, the better you will get. The more you practice, the better you will get. The more what you know, the more that you know is part of the endocrine system, the better you will do on your tests. Okay, so just pay attention to that adrenal gland. All right. So we are now talking about stuff that has to do with your insides, your pancreatic duct. Your pancreatic duct is one of the things I wanted to talk about because it's not on your test, but somebody asked a few questions about your pancreatic duct. Let me see if they have anything more in here than what we talk about. They got the sex hormones, they got the glucocorticoid, the aldosterone. So I'm not saying anything directly related to your pancreatic duct, but I want you to write this down. So y'all got your books, write this down. This is your summary. Pancreatic duct. Okay, so you're going to do a summary on your pancreatic duct. It's kind of like, it's not in your duodenum, but it's kind of like on the side of your kidney. I want you guys to get that down, okay? And tell me what the shape of it is. If we run into it in here, we're going to talk about it. Okay. Right. They're still giving us stuff on adrenal, but I'm not finished with this chapter. It's going down. I just want to kind of get into it because here they start showing us what's going to stimulate your pancreas, rising blood glucose, liver, and sugar. Eat it. And you're not going to believe it. They have like a hamburger. I'm not going to say McDonald's, but they have a hamburger and a French fries and all this crazy stuff that's going to regulate your glucose. And it turns all the way back from your insulin to your pancreas. Okay, years ago when I worked in the OR and I read this book, and when I was in the OR, I'm just from room to room, and I just, I had a lot of trouble losing weight, and that's the first thing it said. The more sugar you eat, the more you want. Your insulin is going to rise, and you're going to want more. And in that book, it gave me kind of like a picture like this. You guys can't see it, but it's kind of letting you know how that glucose and energy is produced, and how it in turn passes from the liver to the insulin to the pancreas. And it all came from eating that hamburger and the French fries. And some of you who are losing weight, I think it's a good thing to, definitely study the endocrine system. Because if you want to know about like the weight issues and how we gain weight and how the insulin plays a role, how the pancreas plays a role, study the endocrine system. And like I say, it's not just us studying for the test. You're studying and looking at things that you probably always wondered about. Okay? So don't forget that. The pancreas, that's your summary. Right to you, that's your summary. I want you to tell me all about that. Add the pancreas, insulin, your liver, those things. I want to see what goes on in those things. What is the homeostasis in that? Homeostasis is less like I'm saying homeostasis in blood as in heart. It's also like cancer soma or hemostasis or metastasize. Homeostasis is doing this, like when you eat something and it's working together. Homeostasis, mixing this up let's mix this cake up. Homeostasis, eggs, flour, sugar, whatever you need. When you get it all together, we just did a homeostasis. This, I want you guys to decipher that liver, insulin, the pancreas, hamburger. Well, you don't have to use hamburger. Whatever you want to use. But I want you to do a summary based on what is it. Why do we need it? Okay, you got the summary thing. You guys got the summary thing in there. The summary tells you what I want in the summary. Okay, YTU, go look for that summary. Where is it? Oh, here's a good picture right here. Where is it? Where did it come from? Why do we need it? Okay, so that's part of it. Okay. It's a little disgusting. I can't show you that. Okay, so here, the pancreas. Okay. This is what we're just talking about. So this is what y'all are doing a summary on. Why do we need it? What is it for? What type of function of the body does it agitate? How, does it play a role in us losing weight? Right? So, remember, the Ozempic and all that kind of stuff, it kind of suppresses your fat cells or something. Because I take the Ozempic, I don't eat nothing. When I started taking it a while ago, I couldn't even eat my favorite food. And you kind of still feel like that with that type of insulin type of thing. But the strangest thing is, with the Ozempic, I don't want food. I want cake. I want candy. So you guys remember, check out that video that I put in there. I got to start putting videos in here. When we did the Ozempic, Wegovy thing, when I started on it, then I was getting the surgery, and we talked about what it did to my body. We talked about I lost 40-something pounds. Why do I need the surgery? So we started on the Wegovy, we started the Ozempic, and the Ozempic, you just don't want food. You're not eating anything. But because I'm like a sugar cake candy addict, that's what I was eating. That's all I would eat. And as soon as you eat it, you go into the bathroom. I'm not sponsoring the Ozempic or nothing like that. You going. And you guys know what happened to my face. My face started disappearing. I was 90 years old. My face started sinking in, And I didn't understand. I lost the weight. Y'all know how small I was. This is recent. But I was almost scaring my own self because my face was looking weird. Again, that has to do with whatever's in that Ozempic that's making you lose weight. Your neck start looking gilly. It's true. It's real. I saw something on YouTube like that. And all I can say was, the sad part is real. I was so happy that I was losing so much weight. Energy, good. But I was looking half dead. So we got to figure out what's up with that. But anyway, insulin, pancreas, your liver. I want you guys to tell me what that's about, okay? Blood glucose declines to set point stimulus for insulin diminishes. That makes no sense. So I want y'all to do it from here. The pancreas is located partly behind the stomach. I wish they have something in here on that section. You guys let me know if you want me to go back in that weight thing and we can do like a segment on that. I got to see, because they didn't have nothing in the digestive system that we could kind of mess with. All right, but do the summary on the pancreas. The pancreas is located near and partly behind the stomach, okay? At the level of the first and second lumbar vertebrae. Oh my God, y'all remember when we did the vertebrae, right? The first and second of the lumbar vertebrae. The lumbar is going to be the lower back. It's in the lower back, okay? The endocrine tissue, the pancreas consists of specialized hormones producing cells called islets of Langerhans or islet cells. We're going with islet cells. Y'all know that. More than 98% of the pancreas consists of endocrine cells, glands, and ducts. These cells secrete digestive enzyme into the gastrointestinal tract, but not into the bloodstream. So I'm not going to read the whole thing, but I want you guys to get it. The function, okay? The islets of the Langerhans produce insulin. We're still talking about the pancreas, okay? We're talking about the pancreas. Remember, we was just getting ready to find something on the pancreas because they had something in here, but they didn't have enough for us. Your YTU, your summary is about the pancreas. See, they don't have much in here. They just have a lot of pictures in here. Decreases peristalsis. Peristalsis is chiming of the food. It's like it's your digestive system chiming of the food. Okay, I don't see nothing in here. Okay, so let's head up with this. Okay, so we're still talking about the pancreas. Okay, let me show you where I'm at. I'm on page 706. And this is where I'm talking about the pancreas. So those of you who have your books open, this is where I'm at. You may have a different page than I do. It's okay, but your information is more than likely going to be the same. Again, you know, YTU, your summary is going to be on the pancreas. Okay, so now let's get to the functions. The islets of the Langerhans produce insulin, okay, and glucagon produced by alpha cells. Both play a role in regulating blood sugar. Now, I don't know if you guys know anyone who has sugar or has diabetes in your family, but all right, my straw got a hole in it. This is what they are watching. This is what they are watching. Sometimes you see it pricking and they want to test and see how much, how the sugar is or how high it is or how the glucose is. This is a process, okay? So the islets of the Langerhans produce insulin, okay, and glucagon. Both play a role in regulating blood sugar, glucose levels. When blood glucose rises, insulin lowers blood sugar. I'm gonna say it again. So y'all pay attention to this part, all right? Again, you know, this is class, but I have a segment that I taught a while ago, not to YTU, a segment that I taught to my regular students at the college, and it was about diabetes. And guess what? I still have it in my phone. Let me tell you something. I know y'all know I got to break in. A lot of the subjects that I taught and added in, I made sure I keep them in my iCloud. So I don't care what classes you go to, make sure you keep things in your iCloud or in your notes of your phone. I don't know where my other phone is. You know, I got 1,000 phones. I want to do that segment. How can I find that without me having to get that phone? We're going to find that, okay? 54. Oh my God, 54 minutes in. You got to be kidding me. So anyway, I want to do that digestive portion. I know my phone is over there, but I'm not going to get up and go over there and get it. We're going to put that in our next segment, and I'm going to talk. We're going to talk about the diabetes thing, even though I really don't like discussing that. I can't even stand going by them stupid dialysis because they my mother hated the dialysis. Every time I see one, I just want to strangle the whole. I don't know. But we'll talk about it. If you guys do, let me know. Hit me up on discussion board. But we're gonna talk about it. I'm gonna find it anyway because I'm gonna end up making the endocrine system into 2 chats. Because after this, we're gonna start talking about oncology and medicine. But I kind of want to stay on endocrine for a minute because there's a few things we talking about endocrine. You're talking about losing weight, and we talking about that doggone diabetes. So and how that's functioning. I'm going to get it, so don't worry about that. But this is where we're at right now. So this is what I want you guys to continue studying. Okay. So insulin also lowers blood sugar by causing conversion of glucose to glycogen. A starch, this is in parentheses, a starch storm form of sugar in the liver. If blood glucose levels fall too low, I'm reading slow because I want y'all to make sure y'all get this. In case y'all don't have your book, but get your book, all right? Those of you who are working at home, get your book. Glucogen raises blood sugar by acting on liver cells. See how that liver plays a role in there? Liver cells to promote conversion of glycogen back to glucose. I don't know why I have thus, the endocrine function of the pancreas is another example of homeostasis. Remember I said mixing them. The body's ability to regulate its inner environment to maintain stability. Okay, so make sure you guys got that down. Okay, 8 to 19 reviews the secretion of the isolate cells and their actions. So I have a picture of the liver, the stomach, okay, the tail of the pancreas, okay. It's not in the stomach, it's just the way it's sitting, it kind of looks like that. And everybody's is different. All body systems ain't going to be exactly the same, but they are in the same spot, but some move, some don't, okay, because they have so many different pictures and they look different unless you've actually seen it. When I seen cardiothoracic surgery, we mostly focus on the heart. I've never seen anything underneath that. When Dr. Gray would go in, he saws right here. But just so he's gone. But because I remember how I used to do it. He used to take that saw and cut that chest right open, and they used to put that the brackets right here. And the only thing we could see is like the heart is the heart area. We didn't see any of this. Okay, I'm gonna show you guys this right here. Dr. Graver was one of the best cardiothoracic surgeons I've ever met in my life. And he actually did my surgery when I had surgery done. Well, he didn't do it. He was training someone, and the other guy did my surgery. Like I'm pretty sure my sister has seen all of these organs live because she does several different surgeries in her field. So she can do all specialties. Okay, so I just showed you the liver, the stomach, the duodenum, the tail of the pancreas, the head of the pancreas, the tail and the head. I don't know why they call it tail and head, but that's what it is. Okay, because the tail is shorter and then the head is bigger. Okay, so let's get rid of that. The pancreas and surrounding organs. Now, I'm going to show you this. The reason I'm going to show you this is because it could be on the test. The pancreas and surrounding organs. So if they have on the test, what is the surrounding organs of the pancreas? You see how I flipped that? That can be on your test. How are you going to retain, Miss Lambert? The candles, dim the lights, have a light on what you're reading. Because you guys know we are in CPT zone. You guys are supposed to be zoning out with the CPT. You remember we're doing the CPT zone, CPT book, as in we're reading the CPT book. Do not forget, don't sleep on your, oh wait, I have to give you this. Let me put this link over here. I'm sorry, y'all. I gotta find it. Oh, here it is. So here's your CMS link, your CMS guidelines. Okay, that's your zone. That's your zone, your CMS guidelines. Okay, so that is for your CMS guidelines that you can get in the zone, get in a quiet coding place. Coding is quiet. You have your books, you're coding. Okay, your tests, you're coding. I have a HIM exam. If anybody wants to do the HIM exam and you feel like you know coding, discussion board me and I'll send it to you. I know you can't get no test to that. You can give it back to me and I'll see, I'll grade it for you. This is for YTU, Sapphire, any of you guys. Okay. So do not forget, a lot of people are asking me, how do you enroll in my course? Go to Sapphire Coding Academy, then you're going to say see courses. Go there and register for one of those courses. I will get an email, you get an invoice, or you get classes. Okay. So I guess that's the only thing they have right there. But that's how you sign up into the Sapphire portal. I put a link up there. I want you to make sure that you go in there because somebody wants to go in there and they ask me the same question over and over. I'm going to give you the exact link. There you go. I'm going to put the exact link on here as to how you register for class. All you do is purchase a program. Okay. That's it right there. All you do is purchase a program. Let me show you how many programs there are. These are my Sapphire programs, okay? So there's an advanced program that's 300 hours. There's a traditional program that's 200 hours, and there's the basic program that's 150 hours. You're going to go on that website and choose which program you want. And then you're going to act like you're checking out, you're doing your registering. If you have a promo code, go ahead and use it. When you get to your checkout, your orientation is automatically uploaded. Your courses are automatically uploaded to you. You can ask, do you want your courses uploaded now? You say yes. And your courses will be uploaded. I will get an email and I will finish your registration into the class and you will have access to the Sapphire portal. Okay, look in some of my other chats. The Sapphire portal is there and the benefits of the Sapphire portal, especially when you are going to be certified. Okay, if you want my book, make sure you go to Amazon.com or go to my website and click on that pay link, pay for the book, and I will send it to you. Okay. So we're still in the pancreas. So you guys are giving me a summary on the pancreas, okay? So this is definitely going to be a long course for us. I have to break it up into two courses. I don't want you guys getting too bored. Okay, pancreas isolate cells. Your insulin lowers blood sugar, glucose to glycogen. Okay, glucose to glycogen. Glucagon, Glucagon, raises blood sugar from glycogen to glucose. Okay, let me show you this one. All right, so this is going to be a long class. We're already an hour in. I'll have to conclude the class. Okay, but I do want you guys to get this. We're going to do this class again. What's your next class? No, you guys got another chat, but it's not a class. It's just a chat. Because I'm already an hour in. All right, so I'm just going to drop when we started this. I'm on 707 because this one is going to be long because I don't want to finish this class without showing you that diabetes stuff that I have. Okay, so we are our end. So I'm gonna cut this class, and we're gonna finish this class maybe later on. I will finish this class tomorrow. What's your next class? Is 15, but endocrine system is pretty long. Let me see what's in here. We're 707. Let me see what's in here. Pituitary. Oh, yeah. Oh, no. We have to do this whole thing. Oh, no. Oh, no. Okay. So I was going to try to figure out how we can cut corner and just do this real quick for the next 15 minutes. We can't. I need y'all to be clear on this class. The endocrine system is no joke. Whether it's for your colon or whether it's for a family member, whether it's somebody you know that's losing weight, I need you to steadfast on it. Okay. So we have concluded this portion. I'm going to give you a second portion. I'm going to drop that. Title up right now. As soon as I finish with this. And this will give me a chance to get my other stuff that I want to do. The syllabus I had done in my old class. I want to do it with y'all. Okay. So let's conclude this. We'll put that thumbnail up. And the thumbnail is going to have endocrine part 2. Okay. So I'll see you guys. Bye. I'm done.